Hello, 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 everyone. Welcome to Built Different Podcast, the DPT edition. My name is Aaron Kennedy,
And I'm Dekevis Perry.
and we are so glad to be back. It's been
So glad.
too long. It's we're so sorry.
That's right. We treat y'all like the stepbrother, the stepchild. But we really are sorry, but we're back. We're back in action. So thank y'all so much for being patient. Like we told you guys on our last post, we're really excited to get into this one. So I'm gonna let Aaron go ahead and take it away and lead us.
Yeah, so just to recap everything, since the last time that we've been speaking with each other, we had our white coat ceremony, and after our white coat ceremony, we had our first clinical rotation. And throughout that, a lot of ups, a lot of downs, a lot of growth like occurred, happened. We completed that quarter. Then earlier this year, we had our last quarter of didactic work. So we no longer have any required didactic work for the remainder of our program. We graduate this September. We only have two more clinical rotations. So big things are happening right now. And there's just so much to talk about. And uh, I guess we can just start really from where we ended off at. How did you feel walking across the stage with your white coat on, Dikibis?
Oh my goodness. Getting a white coat and just being able to walk across the stage is a phenomenal feeling. Just like we talked about, just you're paving a way for a lot of other physical therapists, not only, but we talk about the minority, the 4 to 5% of black people in general, and then also just black males. It's just like being able to do that just really just resonates with me differently, just because I know all the difficult how difficult it was to get to that point. And then also, just because I have siblings that look up to me as well, and then just other people that I know that are like watching and paying attention, just watching the journey. So it makes me, want to do that much more. And then being able to do that and accomplish a huge goal like that I've been chasing for so long, it was just a really surreal feeling. So, and then also being able to watch you, man, like, and the people, that I really care about, just walk across that stage. It's just like we've been in this for so long, and I'm proud of you more than anything. So,
No, man, you gonna make me tear up all over again. It
absolutely.
it was incredible. It was a truly powerful moment. Just seeing everybody walk across the stage, having your name
Hmm.
called, and you be able to live in that moment and don on that white coat and really just embracing the fact that you are crossing that threshold and becoming a black physical therapist, a black doctor. And
Yeah.
I remember one of the moments I actually got a text message from my baby brother, and he had sent me just a congratulatory message, but he was like, "You're the first black doctor in the family," and I'm like, "Oh my gosh!"
And that's a great feeling. That's a great feeling though. Like it's just like wow, like I really just did this. Like
And
yeah.
it really did. It wasn't. You're right. It was such an amazing feeling, and you know what? For the people who come after us, the whole point is to set the bar even higher. So it. I'm sure. Hopefully, that will inspire those, like you said, that watch us, our younger siblings, younger family members, to really just aim high and continue to go forward with all their dreams and goals. So yeah, and I love meeting your
Absolutely.
family. Our families were able to get
Man,
together for a
multiple
brief
times.
moment. Yes,
Yeah.
yes, yes.
So before the white coat ceremony, I actually went out to eat with his family. I got to meet his mom. I got to meet your stepdad. I got meeting Toy. I had already met your wife, but it was just good to sit down and just have a meal with everybody, So very thankful for that. And then also we got to meet up again, like after our last lab immersion. Um, and he came with my family. Actually, my girlfriend surprised. Us. Well, me. I'm gonna say me because I feel like
I knew.
right. So my girlfriend surprised me. Had like my mom there, her family, and all like everybody that was there. It was just a really good time, especially before we sent Aaron off back home. So that was awesome, man. We got to meet both each other's families and just laugh and just share a meal. So that was awesome.
One of the most beautiful things that came out this program is the connections that we've been able to make, and it's just been such high intensity. As the listeners, y'all should know, we are in a hybrid accelerated program. So our program versus a traditional program is 2 years instead of the 3 years. And when I tell you it is nonstop, there,
Uh,
there's there was this one person at my last political rotation. She's like, I have like a month off for winter break. And I'm like, oh, a month? A month? 4 weeks? That's
that's
crazy.
crazy. That's crazy, right? But that's a traditional route, though, so yeah, that's something to look into. I know we talked about it before, but if you do take the traditional route, you'll get several weeks to just have breaks and things like that, versus the non-traditional, which is the hybrid accelerator, like we're in. Um, you won't really get that much. Like the longest break we've had is probably like 3 weeks at
Yeah.
most,
Mhm.
if that. And yeah, so you really got to think about, if I'm gonna have to miss, holidays with people, weddings and, outings and things like that. So, but it's for a short period of time and the goal is to achieve that DPT. So I think the goal is worth it.
Absolutely.
Absolutely.
And now we're here. We just ended our last didactic quarter. We
Yep.
only have two more quarters left, and we had a lab immersion, our last lab immersion, which was kind of bittersweet because that would be the last time we are mandated to be in the same space for academic purposes in order to grow until graduation. But it was incredible. We got to learn a whole lot. We got to work with kids, some
Oh yeah.
pediatrics, got
Oh yeah.
to do some dry needling,
Oh
and
man.
that I'm getting that certification.
Me too.
Absolutely.
What would you say? I know we did like advanced interventions with dry needling, things like that. We also got to practice our manipulations, which I love doing manipulations. So, and then like you said, we got to work with kids and stuff like that. What would you say was your favorite out of all the stuff we got to learn?
I would definitely say the hands-on manual therapy was my favorite, just
Yeah.
because all the reps that you need in order to master that, you
Hmm.
know, it's different when since we're in a hybrid format, we have to do it like
Yeah.
here, like with our significant others,
Yeah.
or like if you are working while you're in school and stuff, you may have an opportunity to provide some type of manual therapy, except
Hmm.
manipulations. But to be able to be guided by one of our professors who created the book, they they
That was dope. I have to say that was awesome. Like it was two of them. It had two professors in there that created books, and one of them was like on pain science, and the other one was I don't know. I think she was just the spine in general, right?
Yeah, it was more general. She was coming out with new research as well. She was
Yeah,
publicizing a new research article.
yeah,
Um, but it was about the spine. I forgot exactly what the details are
yeah.
on that, but we were there were some heavy hitters
Oh
of
yeah.
information and
Hmm.
providing perspective, and
Oh yeah.
I was trying to soak in all that information while they were
Me
there.
too, man. Me too. We had so several of our professors, they have fellowships and residencies and all these different higher education in these specialty fields. And it was just really interesting to hear them bounce ideas off each other just based on the cases that we were going through while we were inside of our lab immersion. And also just hearing like why they would choose one intervention versus another, and just their rationale. But they all came to the conclusion of like, it always is about the patient and they're treating the symptoms in order to get them better. Because a patient can, come in with one kind of diagnosis from a medical doctor, but after they do special testing and things of that nature based off of their experience, they're able to figure out that it may be something else. So it was just really cool to just see how they break that down and then also communicate with the MDs and things of that nature for them to be able to detail that down and just kind of figure out exactly what's going on. It just was like super cool. Like even though they all like were in agreement on like how to get the patients better, there was a couple times they would disagree with each other and they would be like, why do you say that? And we like went through a couple cases and we were all like, wow, like this is super cool. Like being able to be in like live moment, just hearing like how they break down cases was really, really cool. So
I thought so too. Like, it really goes to show that sometimes you can go from different perspectives on different approaches on how you attack a problem, and
yeah,
you're not going to be wrong unless you don't know how to rationalize like the process. Like, how did you
right.
get to it? Why are you doing this?
Yeah.
Some people focus more on MSK type of conditioning. Some people lean more towards neurological. Like, it their reasoning, their motives, and their conversation on how they communicate with each other was definitely one of the highlights of our lab
Oh yeah.
immersion.
Oh yeah. And a lot of them had skills that you can't learn in the classroom. A lot of it was from experience. They would just be like, okay, just based off of what you just told me, I know that it's either going to be these two things. Now I'm gonna just do these special testing. Like they don't even, a lot of times they weren't even going into like special testing for certain stuff. They would just be like, okay, perfect. I know exactly what these things could be correlated to, or it was just like, wow, like, and because we would ask like, how would you know to go to that? They'd be like, experience, like that's the best way, like. So we like had the gurus in there, so it was like super cool to learn from them and just hear everything that they had to say. So I love that.
definitely definitely inspired me to pursue residency or fellowship after we graduate and after
Mm,
we get done with our board exams. So if y'all
right,
didn't know, since we're done with our didactic work, we can now really start studying for real for our board
right.
exams. Since we graduate in September, the earliest that we'll be able to take it is October. But the
Hmm.
normal type of time after September to take it would be January of next year. So you would have September to January to sit and study, but a lot of people are gonna try, of course, that October. We accelerated. We try to get out of here,
Right.
get to this money.
That's right. We're gonna make it happen one way or another. So absolutely. I'm excited for it though, man. We just had a week of board prep too. Just
Mhm.
kind of letting us like educating us on how the process goes, like what it looks like going into like scheduling and things you can bring and what the time is like and just we got to actually experience like a couple of the test questions and breaking them down with instructors that pretty much like write the examples, the test questions. So that was really cool. And we also have a couple of professors on board on staff at our school that actually are test writers. So it's really cool to be able to have those people working in our program and then also hearing how the questions are designed from people who are breaking them down as well. So really cool.
Yeah, I definitely would recommend people who are in PT programs or they are trying to get into PT programs, maybe do some research on the type of uh, facility, not facility, sorry, faculty members that they have, because
Yeah.
it is a rarity in my opinion to have like a faculty member that has experience on
Hmm.
creating test questions because they can just provide you different type of perspective going forward.
Yeah.
So nothing crazy, but it's I think it's definitely a benefit.
Yeah.
Hopefully.
I think Yeah, I think it just comes down to the details, like being able to the questions that they ask them in a specific way. So it really helps you for when you do start board prepping because you've seen questions similar to that, or the verbiage is similar to what you're looking at when you do see the board prep. It's like, oh yeah, I understand like what they're saying about inhibition or
Mhm.
things like that. So it's just super cool.
Yeah. What was your least favorite part of lab immersion, since we said our favorites?
My least favorite live version.
Put it, putting you on the
Uh,
spot.
man, this ain't good. This ain't good. Uh, I'm gonna just say the least favorite part was, it was like you said, it was bittersweet. Um, I just I just can't believe that was my last live immersion. It's just like, dang, like I'll never get to, have that moment, those moments with you guys again. So it was like, I built a bond with y'all, and we learn together. It's just a different experience, like you think about your life, and when you've been in school, it's like, dang, we used to have the greatest time. When you think about your friends you were in school with, so that's what I think about us. I feel like we had a pretty tight-knit group, and we always communicated well. So it's one of those bittersweet things. It's like we all gotta take the next step in life, and we're gonna be, DPTs. So I just look forward to seeing everybody happy. But that was what I would say is the low light of the last lab immersion, having to break away from you guys and not getting that moment ever again. So
Oh man, I will say the same. I know that was a tough question, but I definitely will also say the same. It just this big realization that time is almost done. And I'm former military, I'm a veteran, and I was a military brat growing up myself. And just when you start having the feelings of like, oh, I'm about to separate from my friends or the people that I love and care for, it
right.
things just feelings start to get welt up and you don't really know what the future uh, is like. But I will say, with this particular group of people, I plan on seeing y'all hopefully at what is it, CSM?
Oh yeah. Yeah, you'll definitely see me there. You'll see me there. I mean, we meeting up anyway, but
I
yeah, I'll see
mean,
you at CSL though.
I worry about. Y'all didn't know that's my brother. That's
For sure. Definitely, most definitely. Lifetime. What they say for lifer, for a lifer.
for for life, for life.
Yeah, that's the bro.
But I mean, I know we've been gone for a little while, but have you received any questions maybe from people in the past that we didn't get to actually answer?
Yeah, I do have a couple questions. And that's a perfect timing, honestly. So the first one that I got from them, how do you stand out during your clinical rotations? Like, do you have like any tips or cues or anything that you can, advice that you can give somebody or everybody, I guess, on how you can stand out? Um, I'll answer it. Um, so a couple ways I would say just going into clinical rotations, and this is just for all settings. I've only done as a DPT, I've only done outpatient, but something that really helped me is just having soft skills, just being able to make the patient more comfortable, just understanding that, they are there for help, for something that's going on because they have some kind of issue. Just having those soft skills, being able to talk to them as a person versus looking at them as like a case or just trying to get them in and out to the next person. So those soft skills really, allow them to help you get more information, and they trust you, and you just build that rapport with the patient. So the soft skills, the trust, like I talked about, and then also just being brushed up on everything. This is more so for your CI and then just for yourself, just being able to brush up on all your skills, I would say. Um, so it's like making sure you know your cranial nerves, your myotones, dermatomes, like knowing all the small things in order for you to address those things when the patient does come in. Being able to be detail oriented, being on time. Also, looking the part. That's a big part of also building somebody's trust. If you're not taking very good care of yourself, then it's going to be hard for a patient to take you very seriously, right? So just making sure you show up every day, not only for the patient, but for yourself. And then the last thing I would say is um, just um, being ahead of the game. So coming in, making sure you do like a review, like chart reviews before the patients get there. Don't let 5 minutes or 10 minutes before the patient shows up be you doing the chart review. So when the patient comes in, you pretty much want to know all the details, everything from the MD or wherever the referral source was. Before they get in there, so you're not like just kind of fumbling around, like, okay, it might be this, might be that. You already have a couple hypotheses of what you think is going on, and you're able to pretty much, rule things out as they're telling you what their symptoms are. So those are my tips for just general. Hopefully they help. If you guys need anything else on that, then you're more than welcome to continue to ask me questions or Aaron, of course.
Mhm.
What about you, Aaron? What would you say?
I
Uh,
think I think those are great tips, and a lot of them I'm coming from an inpatient side for my clinical rotation for the first one, and a lot of them actually coincide to the inpatient setting as well. I definitely would like to add, make sure that you are doing more research outside.
yeah.
I had to work with patients that had cerebral palsy or stroke or just any type of radiculopathy, and
Hmm.
that requires less traditional type of physical therapy like you would think. It's not MSK related, so
Hmm.
um, sometimes that require you to be creative. Especially if you're like working with like a Parkinson's patient, you would want to try to do creative and functional different type of interventions and tasks for them. That
Hmm.
also ties into another one is make sure your goals and your interventions are lined up to be functional. At the end of the
Yeah.
day, you want your patients to get to the level that they initially started before the injury or a higher level than what they are currently presenting you at. So forward progression should always be the underlying goal when you're thinking about your intervention strategies. And I definitely would like to highlight, yeah, your soft skills. You are dealing with people that are more than just their injuries or more than just the trauma that has happened to them. You're dealing with what is also associated with it. So that takes a certain level of tact. And that also takes the ability to communicate not only with the patient because they may be confused, they may not fully understand what is happening to them at the moment, but also your ability to communicate with their family members because it
Yeah.
may require a different type of lifestyle that they are used to before incident, and you're gonna have to be the one who spearheads that effort.
Absolutely. Yeah, man. I love that. I'm just piggyback off of it just a little bit because that was really good. So like you're saying, just building up that patient report on those soft skills, they're coming to you and they're very vulnerable. Whenever somebody's hurt, they're just trying to figure out how to get better. So they're trusting you. So that means that you need to make sure that you're on top of the things that you know so you can be able to educate the patient in order to get them better. Because if you don't know what you're talking about, or if you're shaky on a subject that they're trying to get better at, it's not going to make them really believe in the treatments that you're providing, and also making sure you make it functional, like Aaron was saying. So, a big thing of our profession is people that are um, we are under like prescribing exercises in our field. So making sure you're pushing the patient. If they want to get back to work, don't just have them doing small things that they can do on their own. We want to give them things that are more functional into getting them closer to the goal that they're trying to get back to, which is work or whatever the case may be. So just making sure you're on top of small things like that, and just educate yourself so you can educate the patient, of course. So that's what I got there.
Yeah. No, I think no, not that I think I know. Progressing and regressing, like knowing the appropriate time for patients
Oh yeah.
is like paramount because yeah, you may be underdosing your patients with a certain exercise, a certain level,
There you
and
go.
they start getting a plateau in their progress, and you are like, it's the
Yeah.
patient's fault. It is not the patient's fault. It's because,
That's the
because
word. Underdosing. There you go. That was
don't
great.
do that. Don't do that. Do not underdose your patients. And
Mhm.
I will say in this program, I come from a perspective where I tend to be a little bit more gentler, like gentle, like with patients. And I've learned not necessarily that I have to get like hard on the patients, but I do have to provide a sufficient level of challenge in order to elicit the change that I want to happen. So,
Right.
it's just a little bit of tough love. That's it.
Absolutely. Um, if you don't understand like what we're talking about as far as like under dosing your patients and things like that, just an example would be if a patient is coming to work on balance, if the exercise you give them doesn't make them lose balance, then you're not challenging them. They're at where they're at. They're not really challenged. So the exercise you give them needs to make them lose their balance, or else they're not working on it. So that's an example I have for you guys. So
Excellent example, Dr.
yeah.
Perry. Excellent. Excellent.
Thank you. Thank you. All right, man. What else you got for us here?
Um, well, I do know since we have two more clinical rotations,
Oh yeah.
there's some people within our cohort who are still waiting for that third one, so we won't focus more on that. But could you tell us about your second clinical rotation, at least like what type of, I guess, like what type of setting it's at and anything that you're looking forward to it?
Oh yeah. So my second rotation, I have it at a local hospital near me. So it's gonna be inpatient acute care. So patients are, in the hospital, but they're there short term. So I look forward to that because I've never worked in a hospital setting myself, not even as a PTA. So super excited to see what the rehab program is like, what the communication is like across the board, with the social worker, MDs and every other discipline that's inside of the hospital. So that's something I'm really looking forward to. And also like the interventions, like what's the style based on that, just because they have different precautions. Like this is very acute. Like usually I'm used to seeing them after they leave the hospital. So this is like this is really going to be interesting for me. Like being able to see them at their lowest and just really literally getting them out of bed. Like they're at the point where they need rehab to even get out of bed. So this is super cool. And then just seeing them with the lines and all these, hip precautions, and this is gonna be great. I'm looking forward to it. What about you? What is your second rotation?
My second rotation is at a spine and sports physical therapy clinic, so it's still considered outpatient, but
Oh,
they
nice.
so I've never actually I was a PT tech before, so that's where I started in an outpatient
Hmm.
clinic. But my first rotation was inpatient, so I we can go down the rabbit hole with all the lines and twos
Yeah.
and hips and spinal precautions and vitals and
Don't
I
worry. I'm gonna be calling you. Don't worry.
no, no, you need to know your vitals. You need to know.
But
There you start writing them down now. A matter of
get him
fact,
that.
actually, I was told this is not a sponsored video. I was told I was told to grab one of these. It is technically like for nursing students, but it tells you all your vitals. It tells you about sepsis, your QRS complex. It tells you about temperature,
Man,
BMI, like different type of conversions. And the great thing about it is that you can also hold like a medical chart like in it as well. So it gives you
oh man,
so you just have it like right here.
send that.
Um,
Send the link. Send
I'll
the link.
I'll definitely send you the link for it. But the funny thing is that I had got it before I started my clinical rotations, and I never used it. but
What? What? He was just that on top of things. He knew.
but I wish there were days where I'm like, I wish I had this with me,
Yeah,
just even as a quick just a reference. So
yeah,
I would if you want, or if you already have like your own reference material, I would
yeah,
get that.
yeah. Send a link, man. We gonna definitely. I'm gonna take care of that. Don't you worry about
Again, this is not sponsored. This is
it.
not. But the outpatient setting, I'm very excited because that's where I get to actually like do all like the manual therapy and do the special test and really have more MSK related
Yeah,
mindset when it comes to my intervention planning. Um, I was told that they don't see too much like neurological
yeah.
type of
That was my next question. How
yeah.
much you probably just see a lot of neuro with this being spine, but you said they don't see too much. But
No. Mm-mm.
something that man, I'm sorry, it's a little bit off topic, but I had you met him, the guy that we went to the gym with. I don't want
Yes.
to say his name. He said that he was a skater, and he said that he thought that he had drop foot. Well, he did have drop foot, and he said that it turned out to be compartment syndrome. I thought that that was super cool because that's like how you gonna be seeing like higher level people, and they have things that happen to them that are like freak things that happen. So man, I'm excited to hear like what kind of diagnosis you hear about because that's awesome. So you still gonna get like kind of like the sports too.
Yes. So they said from the information I got earlier, they say like a lot of rotator cuff, like so I need to know my nearest if you can and all that other good
Oh
stuff.
yeah,
Um,
that's gonna
but
be fun.
I am very curious on the spine component because
Yeah,
uh, listeners out there, I am a
yeah,
neuro guy.
yeah,
I've been a neuro guy before I got into the program, and then come to find out within the program, I'm still a neuro person.
yeah,
So
man,
I don't
yeah,
know what I'm gonna see about the spine, but we might.
yeah. Hey, it might be something there. You never know. So
I'll make sure I know my dermatomes and myotomes and reflexes.
there you go. There you go.
But I'm super excited because again, that I feel like a typical progression for PT students, they start off in outpatient settings. That seems to be like the trend that I normally
Mhm.
see. So um, it is a little nerve-wracking in my case because I've I've never worked on this side as a physical therapist. I saw what the physical therapist did, but unfortunately I never went into like an evaluation during
Yeah.
like I was never shown that. Am I confident to perform my own evaluation now? Yes, I am, just
Hmm.
because we've been trained on it. We've been putting in a whole lot of work, but I'm like, this is about to be such a crash course, like the first 2 weeks until I find
Yeah.
my flow. So
Right. That's
I'm
okay. It's all a learned experience. So the first 2 weeks are like, hey, what's going on? You coming into an environment you never been in. So that's good. That's good, man. That's gonna be exciting though, because you're gonna be with the athletes and stuff. So that's
yeah.
like I like that the fact that it's like a spine and then also sports kind of give you a little dynamic right there. I like that.
Yeah, we'll see. I have to keep you up to speed with the type of patients. Um,
Yeah.
and no worries, I'll be reaching out to you. I'll be like, this one patient came in. I did all the special tests and it didn't work. I don't know what this is.
Yeah. Hey,
If
call
I
me.
see, if I see, I won't tell me.
Yeah. Good. Man, I'm gonna call you on lunch, man. I'm about to go to the bathroom. Call up. All right, man. That's good with me.
But it's really exciting because we both get to be in different type of settings
Hmm.
that we big picture wise wasn't really exposed to a lot. So
Right.
I'm super excited for you. I can't wait. If
Same for you,
this is
man.
weird to say, I can't wait for until you have like a Parkinson's patient. They're such a joy to work with, but
Yeah.
you have to be creative. You're a very creative person.
All right. I'm ready for it, man. But I feel like it's gonna look completely different because I worked in a lot of
Mhm,
SNFs, but I never seen one like in a hospital setting.
mhm.
So I'm interested to see. I'm really just like, let's do it.
I think one of the best things about working in a hospital setting is the exposure to the different disciplines that are there.
Yeah.
I'm not sure about yours, but I can take a good guess that you'll probably have OTs and SLPs there too.
Hmm.
And just seeing how everybody is working with this one individual patient on so many different type of like ends, just to get this patient ready to move to the next
Yeah.
type of care. I, I feel like it's going to be like extremely eye-opening. And then, of course, you'll be in the talks about discharge planning
Yeah.
with the MD, and then also with the wound care nurse. Like man, first day out there in my setting, I was not assisting, like dressing a wound, but I was exposed. I was, I was like, what is that? Respectfully,
Right.
what is,
That's hilarious. He said, "What is that?"
but the Hoyer lifts and stuff,
Mhm.
um, just the positioning and I don't know. It's a lot of administrative things as well that you have to take in consideration while you're in an inpatient setting, in my opinion. Like it's just, yeah. And you don't have as many patients. I've heard stories about the outpatient volume. You
Yeah, that's
definitely
what I was
don't.
gonna say. You go into outpatient, I don't know how many people they will be seeing or your CI, but mine was seeing up to about 23 to 24 patients a day. So it was very much so kind of assembly line-ish. I would say that was one con of being inside outpatient, just the high volume, and I can see the burnout, that they talk about a lot. But you just gotta stay creative, and I would say just pick the setting that works best for you. If you like things slower, choose more of a sniff, or you like things fast paced, you don't mind seeing high volume, then try outpatient. It might be for you, but just choose whatever works best for you, just so you don't get burned out, and you still enjoy going to work and doing what you love to do. So I think that's very important for any job, not just only PT. So absolutely.
Wise words from Dr. Perry again.
Thank you, man.
Do we have any more questions that we've gathered?
I was honestly about to just talk about real experiences, just the honest, like being burnt out. Is that a thing? Did
Yeah.
I see that in my first rotation? Then, oh, something else I would say is another question that was talked about was the confidence. What helped you build your confidence while you were inside of your last rotation?
Mm, okay. What built my confidence was my failures. Those times, those moments where I had deer in the headlight type of reactions and
Hmm.
I didn't really know how to progress and go forward. Or I would have a patient that I'm working with and I'm not getting anywhere with the interventions that I chose to do, or I had the interventions and patient is just not they're not statting at an
Yeah,
adequate level in order to tolerate those interventions. So I have to figure out a different way in order to still provide a successful session. But if the patient can't tolerate exercise based on pain or based on medication that was given to them prior, or just based on anything, even their desire to actually want to participate, their irritability.
Right.
Um, you have to pivot and you still have to do a job. It's still my responsibility, our responsibility, in order to still perform and get the correct interventions for that day so we can salvage that moment so we can get that person better. So those moments where I was just really defeated, I had to come back the next day just reinvigorated and ready. And
Mm.
there was multiple times where had multiple days in a row. I just was not feeling like I
Yeah.
did the best. So, um, but now because of those moments, I really gain clarity on what my strengths are and what are the areas that I can still work on.
Yeah.
And that has made me confident not only in my own ability, but also just my sense of belonging in physical therapy.
Yeah.
What about you?
That's awesome, man. That's awesome. Dang, that was heartfelt. That was heartfelt right there. That was sense of belonging. Absolutely, man. Like we talked about, you don't want to burn out because this is where you're going to be, you know. So, man, okay. Thank you for that. Thank you for that, man. Anyway, for me, I would say something that built my confidence was also not the times where I did everything right. It was the fact that I was doing things wrong. So, being able to do things wrong and my CI asking me, how would you perform this? And then, you're like, that ain't quite it, or that's completely wrong. They have no problem telling you that. And that's what I want to hear. I want to hear the blunt, honest truth about what I'm doing just so I can give my patients the best care when I am my own clinician. So having them be able to do that for me, and then also my CI trusted me to perform the things that I did wrong or incorrectly on them. So I was able to practice manipulations and try dry needling on them and all these good things just because they really did give me a different insight on what I was doing. It just wasn't like, okay, that's good pressure. If I was doing like any kind of manual, it was more so like, that feels very pokey, or you could apply a little more pressure. So just giving me like the detailed feedback, I think that really did help me out a lot, just so I can be able to take that from them and then apply it to my patients when they came in. So now, my family members, they want me to do a lot of manual on them for some reason. So, and I don't mind. I don't mind at all. So do love that aspect of it. And I'm not perfect. I'm still growing and still learning. But it's just being able to be more comfortable with the techniques and information that I did get to use while I was in my first clinical rotation. So
That's amazing. I can't wait until I get more confident with my manual therapy. Um, my wife says like I'm okay,
yeah,
but I'm like I'm not there yet. Like I'm
yeah,
not. It's not doing what I needed to do. It's doing something, but it's not.
right, yeah, yeah,
Just give me some time. Like, come back. Um,
right,
I do want to talk about burnout. Um, I know that you probably can look back in your past and see different type of areas where you experience the feeling of burnout. Uh, and I really I really don't want that to happen with my journey with physical therapy.
yeah,
So I'm glad that you said that it's very important for you to find your flow, your area, that place that even on the bad days can still have you like keep coming, like
yeah,
because you want to, not
hmm
because of uh just you're almost like forced to, like in a sense.
right,
I don't think that's like the greatest way to live if you have to constantly like show up to a place because you have to be there. Um, but that's why these clinical rotations are so important because it gets that exposure not only to your CI that's there, but to those your CI is connected to as well. They can have and showcase you to other people who have different type of techniques, or you're able to experience in a different, a completely different type of field. Like back in my inpatient
Hmm.
um, rotation, I was afforded the opportunity to see X-rays being done, actually ultrasounds being taken of in an SLP's patient. They were seeing if their esophageal, uh, I forgot the actual name for it, um, their epiglottis was being closed or not as they were swallowing.
Yeah.
So it has nothing to do necessarily like with what we do as physical therapy, but that being exposed to that made me gain a higher appreciation for what SLPs do. And with that, I can see and tie the different things that we do in physical therapy in order to properly assist them when we are working with the same patient. So it's finding the appreciation not only for physical therapy in the field and
Hmm.
the various places that it reaches, but also like the other fields that we are inherently connected with.
Absolutely.
gotta
Absolutely. I love that, man.
gotta prevent that burnout.
That's right, man. Show up every day, like you said, whenever you don't feel like you have to show up, you want to be there. A sense of belonging, like you talked about. So I'm all with it for sure.
So, this has been really our catch up episode, listeners out there. I know it's been a while since we been on here, and of course, we're going to be getting on here a little bit more often, even while we're in our clinical rotations. We want to continue this journey all the way to the finish line with y'all. So please, we encourage y'all to take the time, send Takiva's messages. You can send me messages, um, and we will have a conversation about all of them on each episode.
Yes, sir. As we always say, don't forget to like, share, and subscribe. We definitely look forward to all your questions. We appreciate everything that y'all do. Anything, the likes, the sharing that y'all do, just any kind of advice y'all can take from us, or we can take from you guys. We are open to any kind of comments or anything that y'all want to express to us as well. We'll be back. We'll be more present, okay, here in the future. We're sorry again for how we've had to step away just because we were in a tough time during school. So we're back and we're thankful for y'all, of course. So we'll see y'all soon.